Well, hundreds of local healthcare workers are getting fully vaccinated this week against the coronavirus. First doses went out 3 weeks ago across the DMV. So far, nearly 17,000 frontline workers in D.C. have received their first dose. In Maryland, more than 65,000, and in Virginia, more than 89,000 have been vaccinated. Joining us now, our local frontline workers, Rachel Watkins, the Nursing Director at MedStar Washington Hospital Center, Dr. Raymond Pla, an anesthesiologist at George Washington University Hospital, and George Washington University Hospital emergency medicine nurse, Barbara Nicewander. Good morning to all of you. Thank you so much for joining us.
Good morning, Jeanette.
My first question to you, and by the way, I know that some of you, for example, Barbara, you got your second dose on Monday. Dr. Pla, you got your second dose this morning. Is that correct?
That's correct.
Okay, and then basically you guys got it recently, your second dose. So my first question is, how do you feel? Dr. Pla, I'll start with you.
I feel fine. I feel great. I feel tremendous relief and still a profound sense of disbelief that we're here, that I've gotten my second vaccine, and tremendously grateful as well.
Gotcha. It's been a long road to get here. Barbara, I'm curious, with that second dose, was it emotional for you at all? Was it easier with the second dose having already been through it the first time?
Yeah, it was pretty exciting. It was a long 3 weeks worrying that I wouldn't get infected or there wouldn't be any problems. And they've set up a good clinic at GW, and it was easy to get the second vaccine. And, it's been 24 hours for me, and other than a sore arm, I don't have any symptoms.
Rachel, have you felt any symptoms at all? And when did you get your second dose?
So I'm scheduled for my second dose tomorrow morning, and I feel like it's going to be like Christmas Day, just having that second dose as a sense of relief and freedom to start planning life again.
I'm curious, especially as, I know you guys have obviously been on the front lines dealing with a lot of people who have been battling COVID. What would you say to people who are probably reluctant to get the shot? You guys are on the other side. Nicewander, I'll start with you. What would you say to other people who are reluctant to get the shot?
Yeah, well, I would encourage people to definitely get the shot. GW started an ambassador vaccine program, and we wear a badge that says "Ask Me." And being around the hospital, people recognize me and have stopped and asked questions. And I've encouraged people within the hospital and people outside to get the vaccine. So certainly plan when it's your time to get the vaccine, and be happy that the scientists have actually got this ready for us so that we can protect ourselves.
Dr. Pla, I've asked you this before. We know the Black and brown community is especially reluctant to get the vaccine because of some history in the medical community when it comes to Black and brown communities. Now that you've gotten your second dose, have you been talking to people already, encouraging them to get the vaccine?
I absolutely have. I've had a similar experience to Barbara. A number of my colleagues in the hospital and at our outpatient surgery center, but also out in the community who have recognized me in the last few weeks, have stopped me and asked me. I've even had strangers in the grocery store ask me, how do I feel? And, I'm not sure what I should do. And I always start by telling folks, your reasons for concern and your trepidation, those are real, but this virus is real just as well. And I would encourage you at the very least to talk to your healthcare providers. And but my experience has been a positive experience, and so I share my experience with. I have shared my experience with a number of people who have asked, and there is absolutely no regret whatsoever about getting this vaccine.
Gotcha. Rachel, I'll ask you this. There is some concern with the rollout of this vaccine, right? It's been pretty tough. One thing to distribute it, another thing is to get people to actually take the shot. In terms of logistics, have you seen anything firsthand as far as the logistical really mess that it's been in terms of getting the shots in people's arms?
I'll say MedStar Washington Hospital Center did a great job with the rollout. They focused on associates like myself who were frontline with COVID patients. And since then, we've received more vaccines. So we've opened it up to the rest of the hospital. And just like everybody on this call has said, we're all championing this vaccine and telling everybody that this is hope for the future. And, you know, people are worried about the future of the vaccine, but people need to understand what we see every day in the hospital. It's important to get this vaccine to help stop the spread of the COVID.
Barbara, I'll leave you with the final word here. What's your hope? You know, we've been talking about this vaccine for so long. Finally, you know, it's a bit of a medical miracle that we finally have one within a year. What's your hope for the country and for the world?
Well, I think the vaccine is going to be the pathway to getting back to the life that we remember, but we also have to remember that it's a slow process. The scientists are still doing studies related to the vaccine and how the vaccine has affected various populations, and we have to follow the science, and hopefully by the end of the year we'll get back to the type of lifestyle we used to have. But in the interim, we still need to wear our masks, wash our hands, and certainly socially distance.
You know, you three represent, kind of symbolize the light at the end of the tunnel for so many people that are waiting to get those vaccines. It's so great to talk to you all, and we certainly appreciate what you've been doing on the front lines since March. Thank you.
Thank you.
Thank you.
All right, be safe. Holly,